Welcome to CommonWell TV, where we're interviewing some of the top health IT industry experts and how their organizations are assisting in interoperability. And that said, let's go ahead and now welcome in MEDITECH and their Associate VP of Strategy and Professional Services. That is Larry O'Toole. And Larry, what do you see the biggest benefit when it comes to some of the upcoming government regulations, when it comes to addressing data sharing?
I tell you, I am such a nerd. I was probably one of the few people who were really excited to see the rule actually get dropped and TEFCA be part of it. I really do think that the standardization parts of the language is very key, meaning that that defining the FHIR standards was huge, as well as the common agreement itself. So we were missing some of those key elements for years, meaning that we needed certain types of APIs that were going to be mandated across the board, but also those common agreements. And I think that gets lost in translation sometimes. Some of the key areas where our customers had trouble really with interoperability was executing those BAA agreements and understanding real true patient consent. And the common agreement is really going to help fuel that. Another area was really governance. When you look at what's happened in the marketplace from where some state HIEs failed, for instance, part of it was funding, and the other part was governance. And TEFCA and the promise of having like the RC and all the QHINs and the governance that comes with it is going to be key when it comes to being able to execute on that national exchange. And I also think that CommonWell is really positioned well. We've demonstrated for years on our capability of doing a national exchange, and I think we're in a good position to go after the QHIN status, and I'm looking forward both as a EHR provider, working with CommonWell, and also being a board member of CommonWell. So I'm very excited about executing on TEFCA now that it's dropped.
Larry, this will sound generic, but I think it's specific, obviously, for each one of our members. You mentioned that you're one of our board members with CommonWell. So for MEDITECH, why is interoperability so important for your clients specifically?
Our clients have really demanded excellence for years, and I think that as an industry at whole, we could do a better job. I think the 21st Century Cures and TEFCA, together really bring some promise to them, and I think that they're looking forward to the increased patient care and patient safety that comes with it. So having the additional data that has elements such as allergies and medications that you can bring to the providers and be able to use that for clinical decision support is going to be huge for our clients. Another area is just proficiency, right? So for years, providers have wanted the EHRs to really help fuel their efficiency and not hinder it. And I think some of the secret sauce for that is really having all of that data, but really having the right data at the right time in the workflow. And this really helps enable that for us EHR providers. And lastly, value-based care and the shift in the model is really pushing us all toward population health. And when you look at what the data can bring, especially when you're looking at the FHIR bulk data promises, it's going to be huge for both care coordination and care management, as well as the analytics, so our customers can really understand their populations and understand how they can become more efficient at managing their populations overall in the new paradigm, which is value-based care.
MEDITECH has made available to your providers that care quality connector. What is some of the feedback that you guys have received since then?
Well, I tell you, there's nothing better than actually talking from the mouths of our customers. So I had a few quotes ready. One of them, which is amazing, and this was a hospital that's in California that's surrounded by a number of different EHR organizations that have different EHRs. And one of the key things that the CIO, Jeff Alport, said at the Valley Presbyterian was, CommonWell comes closest to what ONC and CMS envisioned and requires the least development efforts on our end. It has a potential to make HIE common and straightforward, allowing us to reduce our integration technology footprint. And I think the coolest thing that he said was, I'm thrilled that the discussion has transformed from focusing on how do we get the data in the system, and rather how do we manage the information in the most efficient manner going forward. And many of our customers have said that, same type of thing, the same sentiment, which really is we need to transfer that conversation from, technical conversation to making it actionable and bringing value to our healthcare constituents.
Well, bringing value to your patients as well at the end of the day, from the providers to the clinicians to then the patients themselves. But when you think about interoperability and how important it is for patients, where now does this come into play with CommonWell and MEDITECH, and how all of this will begin to kind of to mesh together?
Well, I think, for healthcare to really improve as a whole, we need to get our healthcare proxies, as well as the patients themselves and whoever is taking care of care for their family members, et cetera, to get more involved and actually get to a point where they take charge of their healthcare. In order to do so, they need the data. So they need both records, but also technology. And with the new guidelines that are out there, and the standardization that we have coming forth, and some of the other key policies that are coming out to make data actionable and also help feed third-party apps, there's a huge benefit when it comes to not only plugging in mobile apps on your phone, but putting technologies such as connecting devices like glucometers, et cetera, and bringing that all together, for a patient to basically manage their care, share data with their providers, find specialists, et cetera. And another, I think, benefit empowers the customer too, is like, in the end, is price transparency and trying to figure out what it is that they owe or what their financial responsibilities are, what are the options they might have out there to take care of themselves and do it in a financially responsible way. So there's a lot when it comes to the future for patients, and patients being able to be enabled to empower themselves to take charge of their actual health care, which I think is going to be a huge game changer in the marketplace.
Well, MEDITECH has been a big reason why CommonWell and the Alliance has been so successful over the past several years. And Larry O'Toole, he's one of our board members. We invite you to find out more information on MEDITECH as well as CommonWell as a whole by logging on to CommonWellAlliance.org.